Hello everyone, my name is Grietje Knol-de-Vries from Groningen, the Netherlands, and this presentation outlines the study we performed on pelvic floor muscle activity in males with and without pelvic floor symptoms. I have nothing to disclose. The possible role of pelvic floor muscle activity in male pelvic floor symptoms has not been studied thoroughly, mainly due to difficulties in assessing pelvic floor muscle function in detail. These difficulties may be overcome with the multiple array probe ligand, the MAPLe, which is a probe used to detect EMG signals from the different pelvic floor muscles. The aim of the study was to explore pelvic floor muscle activity in males with and without lower urinary tract symptoms, or LUTS, and with and without sexual dysfunction. We conducted an observational cohort study in males with and without pelvic floor symptoms. For this, we invited all males aged 16 years and older without a terminal disease, limited cognition, or psychiatric or psychological problems, who lived in a Dutch municipality to complete a questionnaire. The ICIQ male LUTS was used to assess LUTS and categorize males into a group without symptoms based on the lowest quartile of the scores and a group with severe symptoms, which was based on the highest quartile of the scores. Sexual functioning was assessed using the Sexual Health in the Netherlands questionnaire and the ICIQ male LUTS sex questionnaire. Having erectile and/or ejaculation problems and/or pain during intercourse or ejaculation was defined as having sexual dysfunction. For this, we selected sexually active males. From the participants of the observational cohort study, we selected males aged 21 years and older for additional measurements based on the symptom scores to allow comparison between males with and without symptoms. Measurements included a MAPLe assessment according to the manufacturer's protocol, including a 1-minute breath test, 10 maximum voluntary contractions, MVC, held for 1 to 2 seconds, and 3 submaximum endurance contractions held for 30 seconds. Data was structured to assess muscle activity for the puborectal muscle, the external anal sphincter, pubo and iliococcygeal muscles, and the urogenital diaphragm. Differences in pelvic floor muscle activity for the 3 tasks and 4 muscle groups between males with and without symptoms were analyzed using Mann-Whitney-U tests. Data from 198 males were available. Males without LUTS had 3 points or less on the ICIQ male LUTS. Males with severe symptoms had scores of 10 and higher. 75 males were classified as having sexual dysfunction. In males with and without LUTS, no differences in pelvic floor muscle activity were recorded during the rest test, but MVC outcomes were significantly lower in males with severe LUTS for the puborectal muscle, the urogenital diaphragm, and the pubo and iliococcygeal muscles. In males with and without sexual dysfunction, no significant differences were found in any of the measurements. To conclude, this observational study showed no differences in pelvic floor muscle activity in males with and without sexual dysfunction. Furthermore, we found that males with severe LUTS showed significantly lower muscle activity during MVC than males without LUTS. Longitudinal studies are needed to further clarify this possible role of pelvic floor muscle activity in male LUTS. Thank you for watching.